Qualcast Nation, we have Hamad Shahbazi in the house. And I'm a bit hype on this one, folks. I'll tell you why. Because there's not too many folks I run into that are like-minded in terms of leveraging technology these days so that we can enhance patient care. And this man has a whole company, okay, dedicated to leveraging tech to enhance patient care. So, Hamad, welcome to the show, my friend.
Wajo, it is a extreme pleasure to be here with you. Thank you for inspiring our whole team at our offsite a couple weeks ago. People were super excited after hearing you speak. So it's really an honor to be with you.
Oh, it was such a great experience talking to the folks in Montreal. But I want to hear about the genesis of Well Health. Like, what brought that into the fold, and maybe a bit about your background. Like, was that your first major company? How did this all come to be?
Sure, yeah. Well, I'm a bit of a tech generalist. I studied engineering at UBC, and then this was the second company that I was an operator for, but I've started other companies that really the whole idea has been how to leverage tech to, positively disrupt and impact, marketplaces and industries and help them not only build value, but also create societal value. My whole way of thinking, and I've sort of tried to coin it in a phrase that I call the impactpreneur as opposed to the entrepreneur, because I think entrepreneurs are so focused on just creating monetary value. And I think for me, the whole idea of creating real value, real sustainable value comes from chasing, impact as opposed to chasing money. If you chase impact, the byproduct of impact will take care of itself in terms of value creation. And so in my first company, I did that in fintech, and the whole idea was to help people be able to confidently pay their last minute bill payments and energy payments and phone payments and cable payments, but make these emergency last minute payments and know that those will go in and they will not have to pay these egregious, terrible fees to reconnect and whatnot. And we ended up saving consumers hundreds of millions of dollars in late and emergency fee payments of ups and downs. Eventually it did quite well. And then Well is really so it was like kind of the democratization of high quality real time payments and time sensitive payments. And then really Well was applying, the same concept to healthcare. Some people get a really great tech-enabled experience that respects their time, and some people don't. Here, even in Canada, where we're all supposed to essentially have the same experience. And so, was there a way that we could democratize access by leveraging technology and make sure that our public healthcare ecosystem also, is able to respect people's time and provide that access? So that was really the genesis of the company. And it's very much a practitioner, like a healthcare provider focused company. Our view is that, look, they're the heroes. They're the ones that are providing this care. Let's tech enable and empower and support them. So really the 100,000 foot, value statement is we tech enable providers. And that's it. That's what we try to do every single day, is to help them not just run their practice, but help them with the best tools that enable them to deliver patient outcomes, the best patient outcomes possible.
Man, number one, I got a soft spot for, what was the name of the first company again?
TO Networks.
TO Networks. That story to me means the world. Like, coming from immigrant parents and seeing like where I was raised, there was a lot of people that were living check to check, and knowing that a company could help navigate them through a tough time, I think is something absolutely special. And then the second thing that I can't help to reflect on is the idea of being an impactpreneur. Sorry. I don't know, that really hits me, because if you look at, yes, money's nice. Everyone, like, everyone's after it. But when you look at fulfillment, when you look at looking at a life that at the end of your days, you want to have impact. That's what we're here for. And putting that lens, putting that as the number one focus, I think it's just a good reminder for folks that this is what it's all about. That, like, I mean, a lot of us that are in healthcare, that was the driver. There's a lot of easier ways to make money, in my opinion. But yeah, like, this is,
Thank you.
what you're saying is just hitting home.
Yeah, well, it's interesting. You look up the definition of entrepreneur in the dictionary, and it doesn't talk about, creating lasting value, and I don't you don't have to save lives, but you got to do something valuable that helps in some way, and it's more about taking some kind of commercial risk to make money. And but every successful entrepreneur that I know actually drove some impactful value, like actually improved a widget or did something that actually improved a product, and all these collective improvements are what propel our society forward, right? And so I was like, gosh, we all interpret this this word differently, but what if there was a word that actually brought the word impact and entrepreneurship together in this impactpreneur concept? So I believe in that greatly, and I tried to get involved in businesses where I can make an impact, and so I want to chase impact, not money.
I love it. I love it. I'm sorry. I gotta let the dog out 1 second.
Yeah, all good.
It will all be edited into loveliness.
No problem.
Hamad, like, give me a sense of some of the ways Well is leveraging technology and making that impact for healthcare providers.
So a lot of it is moving them off, analog tools to digital tools. So, we probably all have the image of walking to a doctor's office and seeing the wall of folders behind some kind of attendant that's receiving you in the reception desk. And so, most clinics now have a combination of that wall of folders and some kind of digital folder systems, which most people refer to as their EHR or their EMR or practice management system. So practice management is one of the things that we do. We have digital systems, but then we also have a series of applications that plug into the practice management system. So we have the country here in Canada, the country's only app marketplace for integrated EMR apps. So apps that make your practice management system more capable. This could be integrations with, BI dashboards for doctors to make them smarter. It could be systems that watch their data and report back to the government, not on an anonymized basis, and an evolving flu crisis occurring. It could be waiting room automation to manage the influx of people coming into their waiting room. It could be online patient booking. It could be digital intake systems that provide workflow to make those clinics operate better so that they can actually deliver on the promise to see you at 2 p.m. on Wednesday. You know what I mean? As opposed to making you wait an hour or 2 hours. What we've seen is because of a lot of the wait that people endure when they go to an appointment in a public location, they'll actually, for public care, they actually won't go even when they have pain. And that's the worst thing you can do, is not seek medical attention when you have, pain's a teacher, pain's a notification system. It's telling us to go see a medical professional. And if we're like, no, it's good, I can take this for another few weeks because I don't have time to give half my day, that's problematic, right? So all these things that allow a clinic to deliver on that promise, and better manage their business and effectively, because we can't forget that healthcare clinics are independent businesses. The biggest misconception about our healthcare system is that it's all government owned. In fact, 99.9% of all outpatient but are funded publicly. So when you come in and see your doctor, over 90% of those claims are paid for by the government, but someone that's not the government is paying for, the leasehold improvements, paying the rent. This is doctors, their friends, their investors, these are the types of, so these have to be sustainable economic business models.
Point. So I gotta really echo this point and how valuable it is to be able to see your patients on time, to have an efficient system. Because if you, this is one of the topics that came up in the talk. It was like the amount of paperwork, the amount of like administrative tasks that are downloaded on clinicians now is a lot, and anything that can kind of automate that or offload that for clinicians is huge. And that point you made about staying on time and a lot of people being deterred to seeing their family doctor or their healthcare provider because of the waits. I gotta say, like, I saw an extreme version of that during the pandemic when people were too afraid to see medical attention, and they were too late to be treated for their heart attack, too late to be treated for their stroke, got some of their limbs amputated because they waited so long, and many people died because of that lack of access or lack of getting attention. So all these tweaks to efficiency mitigate that risk of people not being seen. And the other thing that I really appreciate too is, because you're more efficient, this allows you actually to see more patients. So this is, to me, where the future of healthcare has to go.
Absolutely. Well, we talk about this crisis in healthcare in Canada, right? Like you hear that a lot. A lot of that comes down to an absence of being able of doctors. Not as in they're not present, meaning that there's not enough of them, right? The lack of supply, especially in primary care, and so if we could give some of their time back, that's huge, right? Because then they can see more patients. Exactly the point that you just made, and so that's a really big part of our raison d'être. It's how do we allow family physicians and all providers, but especially primary care physicians, to be able to focus on the care and not running a business. Because in Canada, because the vast majority of our outpatient clinic ecosystem is small businesses that are run by doctors, so they are in this framework where they are providing care and running a business, and that's really, really tough. So what tools can we give them that allow them to do that more efficiently? Or can we then offer other types of business models? So for example, Well doesn't just provide those tools. Our company, it also has a fully managed experience where if you don't want to run your business anymore as a healthcare provider yourself, you can actually join one of our staffed, fully managed centers, virtual or physical clinics, and basically all our tools and staff wrap around you, and you can focus on the care. So think about it as a WeWork for doctors. You show up and you are focusing on the care. And what we're finding success with both of those. But increasingly, especially as millennials and Gen Zs come into the healthcare practice, they don't want to run as compared to the past, because there's data protection, there's different hybrid workflows for on and offline, kind of treatment and care. So it's becoming even more and more complicated and to run your business, the same way that maybe your father or grandfather ran it as a doctor.
100%. To reinforce some of that, we also don't get training in running a business. Like, you're often running on the seat of your pants. Like, I've never had to deal with an outpatient clinic just to the nature of my job, but I certainly have tons of colleagues that have had to navigate this system. And yeah, there's growing pains. There's money lost because of lack of efficiencies, of learning as you go. And your time is money. So the idea is, especially I'm thinking about our new grads, the idea of having like a turnkey, like walking into a system where a company is taking care of all of the nitty gritty, and you just see patients, and at the end of the day, just that be your focus and get a paycheck at the end of the day. I think that would be appealing to many a folk. And I think you mentioned this, but you find there's a significant amount of your clients that are pushing towards that model. Is that fair to say?
Yeah, increasingly we're seeing it. So today, our company provides these tools on an a la carte SaaS basis, and over a quarter of the entire country's providers use our tools in some way, shape, or form. And so what we're seeing is increasingly they want to not run a business, and they're seeking us out because they know us now, because they use our tools, because they also know that we have the fully managed care model. And we now have over 3,000 providers between the US and Canada that work in a patient delivery, patient services business, in a care delivery business. And we see much more movement from people running their own business into the fully managed model than from the fully managed model the other way. Like it's almost one way. Like the flow is almost one way. And it makes sense. It's just with more and more technology coming into the marketplace, it's becoming increasingly difficult for a small clinic to be able to embrace and deliver on all that tech.
Yeah, no, fair enough. So one of the topics that I think we would be remiss to not focus on is how you leverage AI in this, how we use generative AI to enhance the care delivery. And I mean, depending on how you see it too, in my opinion, there's also, it can enhance the patient experience too. But where do you see AI, leveraging AI in the future, or already in terms of, if you guys are already using some of this tech to enhance care?
Yeah, no, thanks for asking. We're really passionate about this. And listen, AI, we've seen is really just kind of like magic, generative AI, like ChatGPT, but it's a little bit scary too, right? So the application of this has to be safe and secure, and really thoughtful, especially in healthcare. We've already brought a product to market that is helping providers. It's early days, but we're seeing really good take up of the service. What it is an ambient AI scribe. So it's called AI voice. And what it does is it's with patient and provider consent. It's listening to a conversation between patient and provider. And instead of just transcribing it in a big long transcription, it is then now generating a medically relevant note that is structured appropriately for the patient's chart. This is saving a ton of time for medical professionals, and medical professionals love it. Like, they love it. And it's changed what we're hearing from them is that it's actually changing the whole ergonomics of the visit. So instead of the doctor having their head and energy in the laptop, taking notes and furiously typing, and once in a while looking back at the patient, they're now facing the patient. They're now observing the patient. They're now doing the thing that the patient needs the most, and that is being present for the patient and being, and I think increasingly as technology evolves, the physician, the provider is really there as the guide to wellness, is there as the Sherpa, is there to sanity check all the different information that all the systems and computers, and putting that in perspective for you, and putting their arm on your shoulder and telling you it's going to be okay. And this is a game changer. Like, we're seeing tremendous interest and success so far with this product. I don't know if that resonates with you as a care provider.
Oh my God. It was actually one of the topics I brought up in the talk was, imagine if, or when, I think I was saying, imagine when you get to continuously look at a patient in the eye. You can hold their hand. You could be that connector. You could be that, the person that they're looking for, essentially, that healer.
Yeah.
And you get to be way more efficient on your time, because you're not having to focus on, oh, did I, am I going to capture all this? Like, it is, to me, a game changer. And the other area, Hamad, where I think we could leverage this is not just for the physician, but the nurses. Like, this is one of the initiatives I want to see in our ICU, actually, because for a nurse to take care of ICU patients, obviously, depending on the level of sickness, there's a lot that could be going on, but a significant part of their job is charting. So if you can offload that charting aspect, they come into a room, you use well AI voice, and they're saying, okay, the patient's neurologically intact, the blood pressure is this, their skin looks like this, and all of a sudden they have their note done and ready to go. Now they could see a second patient, they could assist with another person, they could go for transport. Like, this is, to me, like, I'm a big 80-20 guy, but this out of all the AI ideas, to me, is one of the most 80-20 enhancing productivity. There's so much that gets added by having this freedom.
I agree. And what's really remarkable about it is that you don't have to tell it who's speaking. And it will also cut out stuff that's like more of the small talk, unless like the weather, how are the kids, stuff like that. And it will serve it up to the care provider to make any edits. Because it could have underemphasized or overemphasized something that the provider wants to emphasize differently. So the provider's still in charge, in control, but it dramatically, like 95% of the time for scribing is now reduced and given back to the provider. So the provider, and you know this better than I do, providing care and then doing all that administrative work afterwards to support the care that you just provided, makes your job so much more difficult. And if you got into this probably because you wanted to be a care provider, not an administrator, right? And you're a healer. And so the ability to again amplify care providers to give their time back. Also, we're facing a lot of provider burnout and fatigue. And also in primary care, you don't really get paid for doing this charting work. You get paid to consult and see patients. You don't get so it's tough, right? Like, this can be a tough thing, and doctors are up late at night scribing, based on all the notes that they took, and that's a little bit of pressure on them. So we're really, really excited about that, and we think what happens is this evolves into a voice-activated technology that basically the physician can speak to their practice management system. Kind of like, think about it as Alexa for doctors. So being able to query and prosecute the database and say, I'm about to give Quadjo here 50 milligrams of whatever drug. Is there anything in his medical history that could interact with this drug? And look, you would think, well, shouldn't a doctor know that? Well, have you seen some of these patient files? They're enormous. And people say, well, doctors make all these mistakes. It's not really true or practical to say that. It's just not practical for doctors to have the time or energy to be able to go through that. And this is where technology, I think, can be the equalizer to help doctors make better decisions. And this whole vast area that we're getting into in terms of clinical decision support, which I think is going to be quite revolutionary.
2 seconds. Sorry about that. But you bring up a great point about even leveraging the decision support too. Because I gotta say, one of my favorite topics of discussion, I don't get into it in the show very much, but it is decision making, actually, because I find it fascinating that a clinician, judge, whatever, their decisions could be altered. Same problem, same presentation, but if there's some recency bias, like you got burnt recently, if you haven't eaten, if you're poor, you had poor sleep, if you're impatient because for whatever reason, whatever nurse or practitioner's talking to you, you just want to move on, your decision could be altered. So I'm always I like to pride myself on trying to be as objective as possible, always, when it comes to patient care. And what an amazing tool it could be to have that level of technology saying, okay, yeah, I'm worried about this drug interaction, or even there's queries that you can make is when patients have presented similar in similar fashion in the past, what has been the outcome, what has worked well, like having that added information, and that tech for sure will be there. Like when I look at our EMR, we use Epic. There's I forget the name of the database, but you could leverage all Epic sites, which is
Mhm.
a lot of places in the U.S. and Canada, all the de-identified data to be able to answer some of these questions. But to me, this is a future for sure. Like the decision support. So I think I mean, clearly you're on to something here.
Thank you. Yeah. No, I mean, look, the truth is it's an enormous amount to ask from a provider to be up to speed on all this information. And so this is where technology can be so helpful, so that providers have much better information to go on when they're making decisions. And so that's exciting, right? That's exciting to be able to provide more confidence to patients and providers, especially patients, because providers are going to get, better access to tools, and especially with patients with long histories, I think that's especially exciting, and just the technology's ability to crunch through information, to summarize it now, to be able to bring that back to a healthcare provider as something to review and think about. And this comes also back to AI and data. I mean, there's so much data generated, and I think we've always been like, well, this has got to be valuable, right? But up until now, it really hasn't been. In some cases, it has been, but now you start to have anomaly detection, right? Like the ability, if a provider consents to their data being scanned, there's now apps and capabilities to go through and identify rare disease detection and say, hey, these are needle in a haystack cases that have clear pharmaceutical interventions that can address them, but it's very hard for a provider to know if it's a rare disease. So imagine if a machine looks at the data and says, here's just, five candidates amongst your thousands of patients here that have this candidacy. Look at it. See. And and that could be game changing, right? So that's something that, for example, we've activated in our app marketplace. Providers are starting to use that, and we're starting to save lives. I mean, this stuff is happening. It's happening on a small scale, but it's happening. That's exciting.
Oh, oh man, and it's just what's exciting too is just the beginning, and it's the tech is already insane, right? Like it's
Yeah.
a lot of this is only going to get better, and yeah, I just feel like this is wild. And the other part of that I think we need to all think about, you kind of alluded to it when it came to the needle in the haystack stuff. That added data, in my opinion, could be used to add a more personalized approach to our health plan. Like when we have plans and therapies for patients, like I think that level of data can allow us to be a lot more precise. Like, say you and I both have high blood pressure. What is it about your makeup? What is it about your data that's going to tell me that you're going to react better to drug A versus drug B? Like, because
Yeah.
when we do those studies right now, it's like at a general level, drug A is probably better than drug B. But for all we know, because of your genetic makeup, because of your background, because of some of your demographics, maybe B would be make more sense. So I think this is where the data can also help, because when you're more precise, you have better therapy, you get better results, less side effects, you're more functional. Like you're just a better, you just have better outcomes. So I really like this idea.
Yeah,
Um,
no, it's exciting. I think I call it a golden decade ahead of us, where now the tools are going to get a lot better. For many years, even though technology was getting better, and other sectors and other service areas of our lives were sort of using technology, and like e-commerce, for example, healthcare was not making a lot of progress from a patient experience, customer experience perspective. And I think if there is a silver lining to the pandemic, one of them could be that more interested in technology because they were forced to adopt technology. So we went from like 0.25% penetration in virtual care to 80% at peak pandemic because of virtual care requirements for physical distancing. And that got, providers a lot more interested in anything tech-based. And I can tell you as a guy that was serving this marketplace before the pandemic, it was hard to get providers interested in this. Not because they're not interested in progress, they're just busy. Providers are some of the busiest darn people in the world. Like, and because they make money by seeing patients and by, it's mostly fee for service. It's mostly about, and I'm not sure they really think about the money as much as they think about all the care that needs to happen. So it's yeah, it's really great that now, there's so much more openness. And of course, demographics and the generational change, factors into it too. We got far more, younger people coming in, and the older people are kind of, retiring and so forth. So more and more people will be interested in this with time.
Absolutely. I wanted to chat a little bit about how a lot of this is impacting your own health, because we had a brief conversation in Montreal, and I don't know how we got into the biohacking aspect of things, but when I heard about some of the approaches you have to your own health, it really got me excited, because I love this stuff. I really do love this stuff. So I'm just curious how what made you enter that level of biohacking? Like, how did you get to that place?
It's a great question. Thanks for asking. I love and I enjoyed the conversation with you as well. And look, I think I think it's a lot of cultivating, personal resilience, right? And I think, a lot of people talk about different aspects of their life, and a lot of people talk about, lifetime, and how many years you think you're going to get. And I think we're now increasingly thinking about health span and the quality of life that we'll have. And I think, so much of that is about just, practicing preventative health. And so we all have a personal responsibility to practice preventative health. And I think, as a tech guy, as a guy who consumes data, when I see data that says, like, if I increase the number of steps per day from 2,500 to 5,000, this is what happens to your mortality rate. And if I increase my number of steps from 5,000 to 10,000, this is what happens to my mortality rate. And I'm like, my God, like, that's clear data. And so my personal goal every day is 20,000 steps a day. And you may think, well, how the heck can you run a company by, walking 20,000 steps a day? I make some sacrifices in terms of less TV time and less talking on the phone time in my office, and more talking on the phone time for business purposes while I walk outside. And I also, it's also like, how do we all cultivate mental health and mental resilience? To me, what I find, and the practice of meditation is about quieting the mind, for example. Well, when you walk and when you do something physical, it allows you to get out of your mind and into your body. So I think, we all have to recognize that one of the best ways that we can help the world is by helping ourselves, because we interact with the world. I'm trying to find ways to make sure that I'm the best version of myself. And that also means taking care of myself. And I'm at my best when I feel my best. And I think a lot about this decision of how I feel before and after a decision. So I'll be at a restaurant and I'll tell myself, make a good decision, Hamad, make a good decision. I'll have this little voice in my head. And well, you look at all these wonderful things on the menu and you're like, that'll feel good. That's amazing. That's good. But then I think to myself, think about how you'll feel after, and how you feel. Like, a lot of the things that you dread before, you feel really good after. And some of the things that you're excited about before, after you feel horrible, right? So this before and after thing, like, you're so excited, you're gonna see some friends, maybe you're gonna have some drinks. That before feeling's great. The after feeling's horrible, right? So I'm increasingly trying to tune my brain and think about things of how I feel after. And that could even be a conversation. Like, I'm going to have a tough conversation with someone, and how do I approach this? How am I going to, it may feel really good to get this thing off my chest and be really angry and get it out, but how am I going to feel after? Am I going to have regrets about the way that I had this conversation? So I think just being conscious, and it's tough. It's tough to be conscious, because we're also inundated and we're thinking, 60,000 thoughts a day, but you know what I mean, right? So to me, it's this kind of personal responsibility to live the healthiest, integrated life possible.
I really love this point because I mean we started a wellness platform for healthcare providers during the pandemic because of this. Like we saw a ton of burnout, and the central theme was you need to be able to take care of yourself. Like for you to take care of yourself, you need to be sound in mind and spirit, and physically feeling well. And so this, because a lot of healthcare providers, they're altruistic. They want to not sacrifice their own wellness. And when you think about how you move, how you eat, how you reduce your stress, connecting with others, this is a ticket to being able to be your best self. And for someone like you, like you're an impactologist, impactpreneur. So I know I'm messing that up, but if you're not getting your sleep, you're not getting your steps, like that innovative idea might have just slipped out, just might have slipped, and we all, like when you think about a company like this, the amount of people that the innovation can impact is tremendous, and it's ongoing. And same with us, that we do it more at a one-to-one level. But yeah, that message though of needing to be our best self, I can't reinforce that enough. And I'm curious, just once again, just get maybe a little bit of bro speak here, but what other kind of hacks do you like to implement in your life? Because I'm all about the 10,000 steps. I'm all about the walking meeting. I try and do the least amount of video calls as possible, because being in front of the screens all day, like it's killer. And I use a standing desk. That's another one of my favorite hacks. So I'm curious to hear some of your other gems.
Yeah, well, look, I mean, I'm sure we've all heard about the benefits of cold and heat exposure once in a while. I think that's good stuff. I think, I've been paying a lot more attention to like different forms of fiber, soluble and insoluble fiber, and making sure that, I'm getting good doses of both of those. A lot of what I'm focused on a lot, after reading and researching, is just the real corrosive effect of blood sugar mismanagement. You don't have to be someone with type 1 diabetes to be focused on this. I think we all can basically, by having too much sweets and too much sugar, basically exhibit pre-diabetes behavior, which is basically a major precursor for obesity. So there's so many simple things that you can do that can elevate how you can sort of limit of poor blood sugar. So for example, having apple cider vinegar with a little bit of water before a meal, taking berberine, a natural supplement, can do this. Even changing the order in which you eat your food. Instead of starting the carbs first, start with the fiber first, go to the proteins, then the fats, then the carbs. Just that simple hack can change the way that your body's blood sugar, gets impacted, and how your body sort of interprets and receives those ingredients. So it's a lot of stuff like that I wish I knew decades ago. But I'm trying to learn. And the other thing is, the Chinese say 100 steps after dinner. This whole idea of just moving after dinner, going for a walk, also reduces your blood sugar. We didn't know that. Like resistance training for men as you get older is critical, because we need more protein. I didn't know how much more protein that I need just to maintain my muscle mass. So it's just stuff like that, and just realizing that the supermarket is your pharmacy. It's the key, right? It's like you got all the ingredients there, the incredible nutrient-dense food. It's like you're making those decisions every single day, and the cumulative sum total of those decisions will determine your health span. That's kind of the key, right?
I could not agree more. And I know this is ridiculous, but the amount of overlap with the stuff we're doing, I don't spend so. My hack with the food, with dinner or with my meals, is that if it is a carb centric meal, that I'll just put a lot of protein. Like always think to myself, double the protein. But it's true, if you could think of the sequence, it could be a significant impact. And the walking off a meal, there is science behind that. There's studies behind that. It is legit. Like the
Yeah.
thermal impact of increasing the thermal impact for digestion. Reducing that blood sugar. And I saw similar effects when I had my continuous glucose monitor on. Doubling the
The other one I
protein.
don't think people talk about is your state of mind when you eat. I'm
Hmm.
convinced, I haven't seen as much data on it, but I'm convinced it's going to come out, especially as AI um, comes about. Not because I notice it with myself. Like if I'm not in the best state, I find that food that I ate is not agreeing with me as well as it would if I was in a better state. So I try to not eat if I'm not in a great state. I try to, again, get out of my head, in my body, do something physical and get into a better state. So, yeah, it's amazing. Just how we feel, in our hearts can impact what's going on in our stomach. And you think, well, how is that even possible? Well, it's because it's all connected.
Yeah. No, we had this conversation before we started. That was an eye opener for me. The mind body connection. I am fully engaged in that. Like the way our mental health, our physical, it's all connected. I've seen too many people with these random symptoms, but they're not doing well mentally. Like I'm, I'm, I'm there. But Hamid, I can't tell you how much I enjoyed this. It was really enjoyable conversating about how well is doing and the innovation that's coming through, the where it's coming from too. This is where I think where I saw that right out of the gate, like where you are trying to make an impact and you see the value of the impact. And I know you guys are going to continue to do some great things. It was such an honor to connect in Montreal, and I
Thank you.
really hope this is going to be somehow a future relationship. We got to connect some
100%.
of this technology in our ICU. I'm already got 19 ideas already. But before I let you go, how do people connect with you guys? How do we learn more about Well?
Oh, thanks for asking. The website address is just www.well.company, not .com, but .company. And then you can see us on Twitter, Facebook, Instagram. So we have all the different socials. But yeah, we go to our website and there's a bunch of information there. You should probably be able to find. You can even just Google Well Health Technologies or Well Clinics in your area. You may have clinics in your area. So yeah, thank you for asking. We hope that we can be of service. To anyone and that's really the goal is the goal is to drive societal value. If you go to ESG, we actually have a really phenomenal environmental social governance program that's it's not some big complicated document that it's for us. Ours is really simple. To me, that's how does your an ESG program is how does your company make the world a better place. So we've identified that, and I'm really proud of it. So yeah, if you get a chance, visit some of those resources and let us know how we can work together.
Thank you so much, brother. This was great.
Thank you so much. Have a wonderful day and look